Hey there! Welcome back to the Parent Empowerment and Coaching in Early Intervention or PEACE Implementation Toolkit video series. Today, we're going to talk about another caregiving coaching strategy, demonstration. I'm sure you're all familiar with the concept of demonstration when you're working with parents. Demonstration, or modeling intervention techniques, is a common part of working with caregivers in early intervention. So when you demonstrate, you show someone how to do something. It sounds pretty simple, right? It is. But we also have seen many providers who make some common mistakes when demonstrating intervention techniques with caregivers. Demonstration is not just working with a child in front of a caregiver. It's explicitly and intentionally showing a caregiver how to do something. Sometimes as providers, we may work with the child while the caregiver is in the room, and we assume that the caregiver is actively observing what we're doing. We also assume that the caregiver understands what we did and why we did it, because they're watching. That may be true sometimes, but often caregivers need more explicit teaching to learn how to use the intervention techniques that you are showing them. Effective demonstration requires you to set the stage and intentionally cue the parent to tune in and observe what you're doing. You can say things like, I'm going to show you how we can prompt for communication when you're having a snack, before you demonstrate the technique to make sure the caregiver knows exactly what to look for. It's important that the caregiver knows what you are showing them. Another important part of demonstration is to offer step-by-step explanations of what you're doing while you're demonstrating. Point out the techniques that you're using. Point out why you are using those techniques. And point out how the child responded to what you did. Providing the caregiver with a step-by-step narrative explanation of what you're doing while you're demonstrating will help improve their ability to use the techniques themselves. Here's a quick example of this technique.
To Angelina, and I'll just kind of, are you gonna get baby toy? Clean up a little bit just to have a little more control over here.
Here we saw the provider doing something really simple. She was clearing toys out of the way, so she had more environmental control of the area. But she took the time to explain what she was doing and why she was doing it while she demonstrated this simple strategy. This is subtle,
so just
but important
before I play
because
this
the
video,
parent
just
may not have
listen,
known that there was
just
an
pay
intentional
attention
reason for what
closely
she
to
was
it
doing.
and see how the mom or the provider is reinforcing the technique of balanced turn. Okay, I'm going to play it now.
So what are the key components of demonstration? The first is to tell the parent exactly how to use the strategy that you are teaching them. This is like giving them step-by-step instructions. Think of it as a verbal user's manual. This explanation is critical to effective demonstration. In this video, we'll see the provider give the parent step-by-step instructions for how to use the strategy.
You can imitate her gestures, you can imitate her vocalization, and you can imitate her words. I know, she has mama word right now. Imitate it. Imitate it at least 3 times. Wait and see how she responds, and then you go from there.
The second key component of demonstration is show the parent how to use the strategy. Like we said before, this has to be explicit and intentional. When you are showing the caregiver how to use the strategy, you are doing it yourself, while the caregiver is watching and learning from what you're doing. You can show parents how to use strategies by doing it yourself if you're with them. If you're having remote sessions, though, you can show a parent how to use the strategy by showing them a video clip. Here's an example of a virtual session with demonstration using a video clip. The third and final key component of demonstration is to tell the parent why they should use the strategy. Demonstration involves more than just showing. It's important to explain the how and why when you are teaching a parent how to use an intervention technique. Explaining why you are doing something is just as important as explaining how to do something when you are demonstrating. In this clip, you'll see the provider tell the caregiver exactly how to use the strategy. Then she'll explain why so that the caregiver understands the rationale for using the specific strategy.
Great job. That prompt just seemed effortless for you. Just getting him to point. Just keep in mind though too, like when he's pointing, you prompted the point for the fish and said thank you. Make sure you're just labeling what he's pointing at.
Fish, okay.
What he's requesting, just to make the language more like from his perspective. So like he's pointing to request the fish. We want to model the word fish. Because eventually, your goal, right, is eventually for him to use words.
Demonstrating intervention techniques while you are coaching caregivers is a critical part of effective coaching. We all learn by seeing how others do things. Demonstration helps caregivers see how to use intervention strategies, and it also helps them understand when, why, and how to use intervention strategies. So here are some tips to keep in mind when you're demonstrating intervention techniques for caregivers. 1. Keep demonstrations short and simple. You want to demonstrate the most important parts of what you're teaching and keep it brief. If the demonstration goes on too long, you might lose the caregiver's interest and attention. It could also be hard for them to keep track of what you're doing if the demonstration lasts too long. Number 2, demonstrate many times when you're teaching a new skill. It's important that caregivers have many chances to see you demonstrating intervention techniques. Demonstrating with different activities or in different routines will help them learn how to use the intervention techniques throughout their daily routines. 3. Use simple language. When you're explaining the why and how during demonstration, try not to use technical language in your explanations. Keep your explanations brief and simple. And 4, remember that it's okay to make mistakes when you're demonstrating. Sometimes providers feel nervous demonstrating techniques to caregivers because they're worried about making a mistake. If you make a mistake or the child doesn't respond well to what you're doing, that's okay and part of the process. Just work through it, own it, and explain to the caregiver that sometimes things go as we hoped and sometimes they don't. Having an open dialogue with caregivers about these mistakes will help them see that it's okay if they make mistakes when they're practicing too. Demonstrating intervention techniques is one of the core components of effective caregiver coaching. So, don't forget to use demonstration with the caregivers that you're coaching every session. It will help them learn how to use the intervention techniques that you're teaching them. Thanks for watching, and we'll see you next time.